Hi, welcome to FURst Aid. I'm Dave Meyer. I'm a certified veterinary technician and a certified canine rehabilitation practitioner. This is the rehab room at Oregon State University. Behind me, I have a 3,400-gallon pool that acts as a reservoir for our underwater treadmills. The temperature in the pool is 92 degrees. It's really important here that we have that at therapeutic levels. I don't want it hotter and I don't want it colder. By the time the water gets over here into the underwater treadmill, it's about 88, 89 degrees. The reason that is because I'm looking for vasodilation. With vasodilation, we get more perfusion, right? More oxygenation to the injured area or to the disease-processed area. With more oxygenation, we get quicker healing. But the underwater treadmill itself does a lot of work. The fact that it's got water in it creates buoyancy. So depending on where I put the water on the animal, whether it's up to their knees or up to their hips, causes them to be less heavy, less weight. So up to their hips, they lose about 55% of their body weight. Now it's much easier to walk in here, especially if they have a lameness and inflammation in some of their joint or in their back. But the water also creates a resistance. It's 3 times harder to walk in the water than it is on dry land. So 15 minutes of walking in here is an equivalent to a 45-minute walk on dry land. 30 minutes in here is equivalent to an hour and a half. And you say, well, that's great, but it's also equivalent to a dose of carprofen, which is an animal anti-inflammatory. The problem is that it costs $99 for 30 minutes or less in here, whereas a dose of carprofen is only $2.60. But this doesn't upset the stomach or the kidneys or the liver. So if you look at it that way, it's a lot less traumatic. We also have a class 4 laser. A class 4 laser does something very similar to the underwater treadmill, where it creates heat in the tissues. That heat again creates vasodilation, but it also excites the red cell at the mitochondrial level. And you're saying, well, Dave, what does that do? Well, it creates baby red cells. And so that also helps carry oxygen to the diseased area. Much like a professional bicyclist who maybe wants to cheat and takes his red cells and freezes them, only to thaw them later during an event, place them back in themselves and have that oxygen carrying capacity. We're not cheating, but we are creating more oxygen carrying capacity in the animal. We also have an ultrasound. The ultrasound also creates heat in the tissues, but it does something vastly different than the laser does. The laser, I can help create scar tissue, whereas the ultrasound, I can break down scar tissue. And you're saying, Dave, why would you want to create scar tissue? Well, here at OSU, one of the injuries that we see most common is a stifle repair or a stifle tear, a ligament that tears, a cruciate ligament that tears. This is done by highly active animals, the sporting breeds, the working breeds. We often see it where the animal places their foot in a hole and then twists and we get a tear of the ligament. So how does the laser help with that? Well, we have 2 types of procedures here at OSU. One is called a lateral fibula repair, where they actually drill a hole through the fibula and then take a 40-pound monofilament fishing line, basically, and they crimp it behind the knee. What that does is that mimics the ligament on the knee. So what we're looking for is scar tissue to grow across that ligament and basically be a false ligament where the other ligament was. So you say to yourself, so if you can grow scar tissue across that, then the macrophages come and eat the line. Can we grow scar tissue on a healthy, partially torn ligament? Yes, you can do that, although you need to pick your patient. So for instance, which patient would be best for that procedure? Well, probably not your 18-month-old Labrador that's running around, because you need to keep this animal quiet for 16 weeks. So which animal is the best choice? Probably like your Chihuahua or your Pug or your Lhasa Poo, something like that would be great. Or your cat, a cat would be great. So with the ultrasound, I can break down scar tissue, unlike the laser. So why would I want to break down scar tissue? All right, say we did one of those fabulous TPLO repairs. Do you guys know what TPLO stands for? tibial plateau leveling osteotomy, and some people will say totally pricey leg operation, but that's one of the repairs we do, and the other one is the lateral fibula repair. So if we do a TPLO, quite often we'll send the animal home with orders out to go to the bathroom on a leash, back in on the leash, rest, maybe a 5-minute walk on the leash twice a day, and then passive range of motion. You guys know that passive range of motion doesn't prevent atrophy, right? It just keeps the leg moving. So this animal comes back in 6 to 8 weeks for a radiograph to make sure that this leg has been healed, right? And the leg is healed, but the dog is only toe touching. So he's only doing this, and we palpate, we feel the leg. There's no pain or anything. Can you guys tell me what's going on? So quadriceps tie down. So this big muscle up here has adhered to the muscles around it. We need those muscle bellies to slide across each other. So I can use the ultrasound to break down that scar tissue. So what I'll do is I'll use the ultrasound, I'll heat that up, make sure that the animal has got some anti-inflammatories on board and is sedated. We will then digitally break that away from the other muscle. So we'll send the animal home on anti-inflammatories, but we'll get them in the next day and we'll get them in the underwater treadmill because we want to keep that moving. We don't want it to adhere back down again. I also have electrical nerve stimulation along with the ultrasound. Electrical nerve stimulation we use in combination with the Game Ready. Quite often, I'll have surgeons say to me, we just performed a TPLO, can I get a 4-4-1? And the 4-for-1 means 4 modalities for the price of 1. And those modalities are electrical nerve stimulation. So any of you guys that know what TENS units are, transcutaneous electrical nerve stimulation, it's very similar to that. It's just a little more advanced. The other options is we have icing and compression, and then elevation. So that's the 4-for-1. So it's the nerve stimulation, the compression, the icing, and then the elevation. So what we'll do is we'll go ahead and perform this on the animal post-operatively. It takes about 10 minutes to set up, 20 minutes to run it, and then 10 minutes to break it down. And what happens is the electrical nerve stimulation will vibrate the tissues at such a frequency that the inflammation process starts to break up. And then with the compression, that fluid is pushed out of those tissues, and with the elevation back into its renal system. So then they end up peeing it out. If I can do this 3 times before they are discharged, I can reduce the inflammation by at least 70%. So this is a really, really great deal. It also will give some temporary pain management because of the icing and numbing. And it will also give the animal time to recover. So there we go with that. Does anybody have any questions so far? Oh, and I've been told for you at home, if you could keep your questions till the end, we'll answer those on a roll at the end. So thank you. Any questions from the gallery? So that is actually the icing and compression unit. It's used quite often in equine, but we also utilize it in small animal medicine as well.
How do you protect the suture post-op?
So good question. So along with this and the electricity, as you know, icing is water, and water and electricity not friends. So we actually use a press and seal around the limb before we put the compressor down on top of it. So any other questions? All right, let's talk about the underwater treadmill some more. So as we know, a half hour in here is equivalent to a dose of carprofen anti-inflammatory. I don't know where I was going to go with that. So anyway, working in here is really, really fabulous because the clients will come in and they'll say, Dave, I've been doing this for a couple of times and I don't know if I'm really seeing anything. And I'll mention to them, I'll say, so when you go home, does your animal scratch after defecation? And they think about it for a second and they say, oh yeah, what's up with that? Well, before when they had their lameness, they weren't confident enough to stand on 3 legs. So now they're confident enough to do that. So they'll scratch at the end. Sometimes the clients are just too close to the trees to actually see the forest. Let's talk about different processes and how we use the treadmill in those processes. So for rear limb lameness, this is really the machine. What we're looking for is compression and extension. It's just like lifting weights. So every time the animal puts its foot down on the treadmill, it pushes it back into extension. And then once we do that over and over, we create fatigue. And with fatigue, if we give them nutrition and rest, those muscle fibers will get bigger. So that's kind of another theme that we see in rehab. Along with the heat, you've got compression and extension along with fatigue. Those are the types of things. For instance, in any of our exercises, we're looking to fatigue the animal and then release them from that exercise. Because of the herding breeds and their intelligence, we have to change those exercises minutely to get them to continue it. For instance, we'll have an animal do a sit to stand, which of course is a very simple exercise. You ask the animal to sit. Once they sit, you close that space off between them and their nose. So if I step forward, their nose is right here. I say to them, can you stand? They look at you disbelieving. And so I'll just tap them in the side and they'll stand up. That really works their core out. Anytime you can strengthen the core, it helps on lower back. I can't tell you how many times that I've seen animals that have limb injuries and nobody mentions anything about the iliopsoas. I think the iliopsoas goes undiagnosed greatly in a lot of our lameness exams. Forelimb lameness, so shoulders and elbows. I see this a lot in the giant breeds, and the best thing for that really is swimming, which is awesome. We can swim in the underwater or in the pool, or else I can also raise the water in here and swim them in here. Unfortunately, animals with back injuries, swimming is not their friend. Can anybody tell me, you're all vet students, can anybody tell me where is the most common space on the vertebral column that discs are herniated? And these are in our long back, short leg dogs, dachshunds, corgis, bassets. Anyone? Close, but no. The TL junction. So at T12, T13, we see that. So dogs, when they swim, they dog paddle, right? Okay, so when they're dog paddling, they rudder with their back legs. They don't always swim. You will see some that what we call all-wheel drivers that swim with all four legs, but more often they're just ruddering. So when they're swimming with their front legs and then they rudder with their back, where do you think the fulcrum place is on the animal? So where do you think they twist? Right at T12, T13. So once you have intervertebral disc disease, it doesn't go away. So these animals that have bad backs, swimming is not their friend. What is their friend? What, say a dog has lumbosacral disease, which most dogs get as they grow, as they get elderly, you'll get a lumbosacral disease. Nothing? Okay, so when these guys get lumbosacral disease, one of my first questions to the client is, hey, how's your dog's bark? Because lumbosacral disease can be neuropathic, yes? And so can laryngeal paralysis. I can't tell you how many times I've said, hey, how's your dog's bark? And they say, oh, you're right, it's gotten a little raspy. So at that point, I say, if you haven't started to feed your animal in an elevated situation for food and drink, now is the time to start that. Because with that neuropathy, you're seeing stuff happen up here in the laryngeal folds where they're becoming paralyzed up there. So those two things correlate together. And it's really fun to see the clients put that together. Okay. Can I swim a dog in the pool? Yeah, I can swim a dog in the pool. Do I choose to swim dogs in the pool? Well, it's good enrichment for them, and it's a good aerobic exercise. But as far as really getting some recovery with it, it's not optimal. For instance, I have several patients that are giant breeds. I have a Newfoundland that we swim in the pool, and when we get him in there, he doesn't swim. He just kind of floats. Although that, in my mind, is okay, because what's happening is, as he's hanging in that warm water that is still causing the vasodilation, and we're still getting that great perfusion, we get traction with it, meaning because he can't touch the bottom, his limbs are being pulled towards the bottom. So we're getting traction in these joints, we're getting these open. And so that's very advantageous. Questions about swimming. Okay, so for you folks at home who are thinking to themselves, well, I can swim my dog in the lake or in the river or in the tub. It's not the same thing. It's not. The warm water is key. In rivers and lakes, we don't know about the bottom of it. If it's a rocky entrance into it, we could cause more damage than we're causing any benefit. Also the water, the temperature, because the water is cold, muscles don't get soft, they stiffen up. So if you've got some sort of inflammatory process going on, that's not going to be beneficial because now the animal's just going to get stiffer. Let's talk about what should we do for an animal that's elderly that has lumbosacral disease. Well, the best thing would probably be to rest that animal, yes. But as we know, as we get older, resting tends to stiffen us up. So there's a combination of things you have to do. And I've had students say, well, so what's the percentage? Do you rest them 40% and exercise them 60%? Well, yeah, maybe, or the other way around. Maybe you exercise them for 40% and rest them for 60%. Or if it's a cat, maybe it's 10-90, you know? So I like the way that I smile at that one. So with a cat, maybe he rests 90%, maybe he's active 10%, or maybe they're active 90% and rest 10%. More often it's closer to the 40-60, but you get what I'm trying to say. Nutrition. Nutrition is also key once we get the animal into recover and rehab. We need to get their muscles to fatigue to get them bigger, but you're not going to get them bigger without nutrition. So nutrition is key. Talk to your vet about what the animal needs, how many calories it needs, that type of thing going in. Let's see. We get a lot of different breeds in here, a lot of working dogs. And I get people who say, Dave, you've been in this business for 27, almost 30 years. What's the best breed? And I say, you know, I'm the worst person to ask because I only see broken animals. So a rescue of some sort is fabulous. Any household full of love is what I say. So that's where we go. We do work with felines in here. Pretty excited about cats. I'll often get clients that say, how do you get a cat to walk in the underwater treadmill? And I turn to them and say, I wish I could bet you money that I can do this today. And there's a particular way we do it. For instance, what we'll do is, clearly, we've probably had a canine in the treadmill prior to, and so we'll clean the treadmill out real well, and then we'll spray it with Feel Away, and we'll let that die down. Feel Away is a feline pheromone. So we let that quiet down, and then we'll have the client and the animal come in, and we'll all sit on the table, and we'll discuss goals. What is it that we're looking for today? What is it we're looking for by the end of the week? What is it we're looking for at the end of the month? And we will talk and discuss how we're going to get to there. Once we get the animal kind of settled down, we're all talking and petting the animal, I will pick up the cat and I will step in the underwater treadmill. And I will put the cat down on the floor without any water in it, and I will shut the door. And you say, does the cat posture to jump out? Absolutely, that cat doesn't want to be in there. So what we do is we will place our hands over the top of it. Can any of you tell me what reflex that is? What is causing the cat to not want to jump out while I'm placing my hands over the top? It's called a raptor reflex. So it goes back to when birds would fly over, and so they're prey, so they don't want to jump out. Then I will start the machine, just the floor. So the floor starts moving and the cat will be confused and say, I don't know what's going on here. Then I add the water. Because if you were to take a cat and try to place it in the water, it will just climb up you and jump out. But as the water comes up, they're not happy about it. They vocalize, but they put up with it. And then they do it just as well as the canines, if not better. So when people say, oh, cats, you can't get them in the underwater treadmill, I kind of scoff. over my time in veterinary medicine, I've been privileged to work with some very, very intelligent animals. Currently, my dog is a fairly intelligent dog, and I believe she's got a vocabulary of over 100 words. But I also believe that most cats have 3 times that as a vocabulary. They just don't care, because I will talk to cats and you can see that they're acknowledging you. They just choose not to do what you're asking them to. Any questions about cats in the treadmill?
How can owners be involved with their animals? We're getting a patient.
Awesome question. So, sure. The question was, how can owners be involved with their animals in rehab? Well, depending on what type of rehab you're talking about. If you're talking about rehab here at Oregon State University, it's great. All of our clients come in, spend time. It's an inpatient appointment. The animals are not sedated. They're all awake and ready to go. I can't tell you how many times I've had clients say to me, you know, when we come to OSU and we get to the corner, the animal starts whining and things because they know they're coming in here. We don't take any temperatures. We don't usually draw blood. It's always about encouragement and treats and things. So this is a really, really happy place for animals. In fact, I've had clients say, will you do a nail trim? And I say, do they normally let you trim their nails? And they said, no. And I said, I don't want to make this a bad situation for them, so we can't do that. But how can people at home get involved with rehab? Well, I think it's more of identifying what's going on with the animal, because there are certain things you can look at and work with, but there are other things that you'll need professional help with. For instance, the animal is playing ball and comes up a little bit lame. The first thing the person is going to think is, well, he twisted his ankle or he twisted his knee and it's just a sprain. And that may very well be. It may resolve and then it may come back. It may wax and wane, but it's really hard to like diagnose that as a lay person. So I recommend, of course, going to see your veterinarian and see what's going on. Things you could do at home, like I was alluding to before, probably not putting him in the bathtub or take him to the lake or the river for therapy. If you want to do that for enrichment, great. Things that you can do at home, hot packing. Surgeons will always say ice, ice, ice. And for an inflammatory process, absolutely. But we know as humans, when we use something warm, it's comforting as well. So depending on what's wrong, if the injury just happened, it's acute as opposed to it's been going on chronic for a while, which answer is best? Well, if it's acute, I'm going to say ice. But if it's chronic, I'm going to say a warm compress. And so how can somebody at home do a warm compress? I say take a washcloth, put it under your hot tap, as hot as you can take it personally, squeeze it out. By the time you get it to the animal, it's going to be cooled off enough not to cause burns. I don't like microwaving fluids for hot pack. I don't like using electrical heating pads. These have all shown to cause massive burns and things like that. I think we've all dealt with enough of that to avoid those things. Exercises, sure, there are certain things you can do. It's really simple things. My favorite exercises are the ones where the animal doesn't know they're doing it. For instance, that sit to stand I was talking about. Hill work. So depending on what your animal's problem is, if it's, say, the animal's shoulders and elbows are bad, and we're going to do some hill work to strengthen those, going straight up and down the hill is probably not the best idea, because going up the hill is fine. You're going to load all that weight into their hips. But coming down the hill, you're going to load into those shoulders, which is the pain problem. So how can we work the limbs and put pressure on them, fatigue them without causing the extra pain, right? So instead of going straight up and down the hill, why not serpentine it? Go back and forth up it. Then it's always the down legs that are driving. So it's the down right front and rear leg. And then on the other way, it's the other leg. So you're working one side versus the other side as opposed to front to back. So there's certain like things like that. Stairs. Step work is good, except depending on what the animal's problem is. Maybe so many stairs could cause them to fall. So how do we do that? Just slight elevation back and forth to get that muscle memory to work for them again. I say curbs. Curbs are only one step. You walk along the boulevard, step off the curb, walk the street, and then back up on the curb. It's simple, one step does that type of work. The sit to stands, puppy planks. So for instance, you have one of these inflatables. And folks, you don't need to purchase these. Everybody has things at home that you can utilize. What I'm looking for with this piece of equipment is instability. So when the animal puts his paws up here, it can't stand stable. It moves back and forth. So again, one of those pillars of rehab, their muscles are extending and contracting, you know, and that's how it's like lifting mini weights. Then I'll have them put their paws up here, and then I'll extend their neck with a treat. I'll grab a treat and have them reach for that treat. That lines up all of those muscles along their spinal cord and gets everything really nice and firm. And it also works their core. And then I'll release them. I alluded to the herding breeds before, and this is what has happened to us in the past. So we'll have a border collie or a Australian shepherd, whatever, do this type of exercise, and they'll notice that we give them the treat once they fatigue. So once they show muscle fasciculations or shaking, right? So the next time they get up and they feign it. They fake that they're fatigued so they can get the treat. They figure out what the goal is. So for these dogs, we have to change it up. So we have a list of probably 30 or 40 exercises we like to send home. And out of that 40, 10 of them are very, very similar to the same because of the herding breeds. They learn what you're looking for, and then they make that happen. So to add, make the exercise a little more extreme, we've taken the border collies and those guys, and we'll have them do a sit to stand on the ground, and then we'll have them get up here and do a sit to stand. And they will do it. It's pretty amazing. But again, a couch cushion can facilitate that, because all we're looking for is that instability. And that goes, it's also the same theme that you will see with the temperature of water with stability. So the reason that the temperature is 92 over there and 88 and 89 in here is because of that perfusion, that vasodilation, but I also don't want the animal to pant in here. So what happens is we want nice form in the underwater treadmill, just like lifting weights. So we want the animal to walk straight through the water, nice form. If they pant, the water starts to do this, and now they're moving out of, and they can strain themselves. For instance, if you were a power lifter and you grab that weight and you brought it up to your waist and put it down, if you grab that weight and then stumbled, all those little muscles that are supporting will be traumatized, and that will be a problem. So that's the reason that we have the water temperature in there, and we just want the animal to move nice and smoothly. It's basically, they're lifting weights inside this underwater treadmill. Everything we do kind of creates that fatigue and muscle that with nutrition will create that muscle fiber to get bigger. And that's what we're trying to do. We see these animals that come in and whether they weren't using the leg for a couple of months or they just fractured it, there's going to be muscle atrophy. And to get them to be physiologically correct, we need to repair that. And so that's kind of what we do in here. Questions about that? Go ahead.
You alluded to the pillars of rehab. I was just wondering if you would mind going over what those exactly are.
So for me in here, it's heat, the compression and extension, and then the nutrition. Yes.
That question.
So the question was, I had referred to pillars of rehab in here, and when I had discussed them earlier, they're really pillars for us in here. They're not written down in a book. They're just something that we utilize. And so the pillars are heat, which you see in the water and the laser and the ultrasound, extension and contraction. You'll see that in the underwater treadmill as they're walking on the tread itself, or any of the exercises that we're running them to fatigue. And then nutrition, of course, that's just something that we all should pay attention to. Any other questions? Are there questions from the group?
I think the first question is, how do people access your services and when should they come in to see you?
Okay, so the question is, how do I access the services at Oregon State University and when should you come in? Well, when you should come in is when you see a lameness or an injury to your animal. But I think the quickest way for you to do that is to see your veterinarian and then be referred into us as opposed to coming directly to us. Originally, you will see one of our surgical services, either our orthopedic service, which would be ideal, or our soft tissue service. And then rehab is recommended and you come in that way. Once you get on my service or our service, you have a 1 year to utilize it, whether you stop utilizing it and then you see a backslide or a re-injury and you come back in through us. That's really the best way to utilize us. What can you do to prevent these things? Oh, that's such a many-faceted question. I see a lot of animals that as they get older, clients will feel that the activities they did when they were younger are what they need to continue to stay with them or stay young. And it becomes a situation where the sympathetic system on the animal will help them perform. You know, they go for these 6-mile walks every other day for their entire life, but now they're 13 years old and the owner thinks, well, we should continue this. Well, you have to kind of remember, you're taking your 90-year-old grandmother on a 6-mile hike. And of course she wants to do it. She has enjoyed it all her life and she wants to make you happy. So maybe kind of look back at what we're doing to our animals as they age. Remember, they age much faster than we do. And I like to, when I take my animal for exercise, I like to avoid places that have holes in the ground. Gopher holes, those types of things. I can't tell you how many times we've seen fractures because of gopher holes and things like that. Just good stewardship, taking care of your animal, giving it lots of love. That's really how to prevent seeing me.
What kind of exercises would you advise for animals who are getting older, they're starting to get lame?
Perfect,
and you can
perfect.
do at home?
Yep. Question is, what kind of exercises do I recommend for animals that are getting older at home? It's really basic, really simple. Take them for a walk and not a forced march. Nope, let them sniff, let them take their time. 20 minutes, it's perfect. Just keep that up once a day. Again, it goes back to that rest and activity balance. Should we put a dog in the underwater treadmill? Okay. Lydia, can you go grab Ivy? Is there another question I can answer while she's grabbing kiddo? It's right here. What about for a cat? Oh, there you go again. So it's rest and activity. So instead of letting them sleep 90% of the day, go get the feather out, get them to do something, you know, chase it down the stairs, something, just keep there. Because what we forget about, and this is what I did my presentation on to receive my certification. We always talk about the physicality of rehab. And we don't talk about the cognitive. And I kind of alluded to it when I said the clients come in and the animals start whining because they're so excited to be here. Hi, can you hop up in there? Ladies and gentlemen, Ivy, can I have your clothes? Good girl, good girl. Okay, so usually we put a harness on the animals, and that's because if you can see in the underwater treadmill, the light gray area is the only part of the tread that moves. And so the dogs or cats will sometimes put 2 legs on either the side or up front and just work with the other 2. We call them skateboarders, and they're cheaters, but she is not a cheater and she does a good job. If we don't have to put a harness on them, that doesn't impede what they do. So if we have to, we do to keep them in the center, but if we don't have to, it's ideal. The other thing is with the older dogs, we actually give them PFD, so a float vest and then an inflatable collar to keep their ears out of the water, because I can't tell you how many times dogs just hate getting their ears wet. So Ivy is healthy. She doesn't have any current problems. And so I'm going to bring her up to speed, and then I'm going to bring her into a trot. This machine will only go 5 miles per hour, but when you're in water, that's really fast. And last time I think she broke trot at about 4 miles per hour, so that's pretty fast. She's a Kelpie cattle dog. She's a dingo. Yeah, just a minute. Are there any other questions from the Q&A? Oh, I'm gonna have to repeat that, aren't I? Can you repeat it to me?
Is it good to swim a dog with the TPLO, hip dysplasia, and possible back pain?
Okay.
Especially if you're unsure of what's actually covered.
Oh man, that's multifocal. So the TPLO, yes, swimming a TPLO is awesome. Hip dysplasia, swimming can be okay. It's not ideal. Underwater treadmill would be better. But for the back, swimming is not your friend. And that reason is because of the twisting and not the firm. With the underwater treadmill, not only are we looking for them to have a consistent gait, but the pressure they put on that treadmill and forcing into those joints causes those joints to strengthen up as well. Also, moving around, as we know, also moves synovial fluid along those joints and helps lubricate all of those stuff. I think somebody wants to get going. Here we go. So I'll start her out pretty slow. What we're looking at right off, she's going to step up front. Right off, we're going to look at where she places her feet. Normally with a new animal in here, I don't like to look at them for the first couple of minutes because it takes some time for them to acclimate. So what you might see might be indicative of nothing. But what we kind of look at is where they're placing their feet. As you can see, she's a little bit narrow up front, meaning she's pulling over, or what we call posting. And that can be indicative of a rear lameness, which she doesn't really have. She's just wandering around looking at Lydia. And she's a little bit wide in back, but that's just because she's protecting a little bit. She's just a little bit resistant. When I speed her up here, that's going to go away. Wow, you're trotting real early. So this is 2.5 miles per hour, and she broke into a trot. So somebody's a little tired. But you can see the front feet widened up a little bit. But she's got a nice, if you count them out, she's got a nice 1, 2, 3, 4 gait. They do, dogs and horses will do a 1-2 gait. Does anybody know what that's indicative of? Not so much in equine, but in canine. So it's a pacing gait, you know, when horses pace with one side moves at the same time. If that is present in a canine, that can be indicative of hip dysplasia. It doesn't automatically mean it, but it can be. And it can be just how they are as well. So when you see a dog walking at you on the street and they're dropping a shoulder, what do you think is going on with them? So it could be that. It could be that shoulder, could be that elbow, could be that carpus. And it also could be the opposite rear leg, could be the stifle on the opposite rear leg. Another gait you guys will see is when the animal is throwing their rear legs forward. So when they walk, they throw their leg forward. So they're using those muscles to throw forward because their hips hurt. See, So as you can see now, the water's kind of splashing back and forth, not ideal. But we'll slow her down a little bit, get her into a sweet spot. There we go. And there we go. Yeah. So again, when she extends her limb, when she's walking forward, and then she's forced into extension and compression, she doesn't have a choice but to work in there. All right. Is there another question from the Q&A, folks? Let's do that. I'll move her out. Any questions on the underwater treadmill? So yes, I've had that. So the question was, do I ever see an animal refuse to walk in the underwater treadmill and just slide back to the back? As they get tired, they tend to do that. And I've had clients say to me, do you want them doing that? I say, not really. But if you think about the force, when they slide back, it takes twice as much energy to come back to the front. So if you balance it out, it's like they're working in the same place. There are several things that animals can do in here that wouldn't be ideal for their condition, but I allow it because it doesn't affect what we're working on. For instance, if I have a dachshund in here, we're working with a IVDD, a back dog. If they put their front paws up here on this front one and don't move those, but work their back legs, does it bother me? No, because I've got their back legs working. That's what I'm looking for. The big newfie that I put in the pool and they just float, I'd like them to do some work, but we're getting that traction, so that kind of works too. All right, kiddo. Yay! So I'm going to warn you right off. She's a drive-by kisser. So if you lean down to say hello, she's going to give you a kiss, and she might be a French kisser too. So. Question?
I have a quick question.
Go.
I've never seen it written anywhere, but do you know if horses and dogs express lameness the same way? We always talk about in horses down is sound. Is it similar to dogs?
So the question is, do horses and canines, equines and canines, present in the same way for lameness? No, because of a little anatomy thing called paws and hooves, as opposed to standing on a finger, and then what they're doing as well. Like one of the technicians today, predator, horse, prey. So although they have similar functions, they do present differently. These guys have more, I think, more cruciate disease, of course, because it's than equines. Any other questions? Quit fighting me. Any other questions from the gallery? Go ahead, give me a couple. Lydia. Go with Lydia. All right. Okay.
Question about like wheelchair support. For
Oh.
dogs, platforms.
Okay, yeah. Sure. So wheelchair. I just had this question today, actually. So wheelchairs can get rather expensive. There's one off of Amazon that I like quite a bit. It comes in 3 different sizes, small, medium, and large, and it's highly adjustable. You can adjust the width, the height, and the length. And I believe for the large, it's like $450. For other wheelchairs, they can get quite expensive. We will use Eddie's Wheels off the internet, and they can range anywhere from $800 to $1,200 to $1,600, depending on what you're getting. If you're getting a 2-wheel as opposed to a 4-wheel and things like that. So if you had any more detailing questions, you can certainly email me and I will get you some more information.
Kind of from a rehab perspective, do you recommend that type of use, or when do you make that decision? I think there's more ways.
So a lot of times it's due to mobility, meaning they choose not to go anywhere because it's difficult or painful in their back legs. So it really depends on what the problem or insult is, and how we're going to deal with that. So asking your veterinarian, their recommendations would be one resource. I find that once these animals utilize these wheelchairs, they find a whole new world. I mean, they'll get out and they get exercise and they get to run around, they get their legs back. And so I find that really advantageous.
Is conservative management ever effective for a partially torn CCL, or is a complete tear unavoidable?
So cruciate disease. So the question is cruciate disease manageable, or is it inevitable? Yes and yes. It is manageable in the fact that you can get help. We can laser. We can help with pain management. It just depends on the degree of the tear, of course, and the type of animal you have. If it's a very active animal, we're probably going to recommend a TPLO type situation. But the nice thing about cruciate disease is that the clients, after they see one, they recognize the second one really quickly. And if we have a partial tear, like I said, we can try lasering and scarring it, or we can just have them rest. If nothing else, rehab in itself prior to surgery helps the muscles be less atrophied at the time of the surgery. So even if you're not sure if that you're going to go to surgery or if that is torn, doing some exercise, controlled exercise, is going to help build up that muscle for the possibility of surgery. So I know that was kind of 6 of one, half a dozen of another, but yes.
Several questions in here related to arthritis. Kind of, how do you, your animals diagnosed with that? Where do you start? So maybe just kind of bigger picture about arthritis.
Yeah. So arthritis, basically joint arthritis, articular arthritis. Again, it's a pain management situation. Each animal is individual. Each degree is individual. I believe we start with anti-inflammatories, exercise, warm water therapy is excellent for arthritis. Warm compresses are great. I believe that it's really keeping the animal moving. Just like in human beings, as we get older, the more complacent or more static you get, the more stiff you're going to get. So animals, especially canines, love consistency. So if you can get them out to a walk at the same time or close every day, they really appreciate that. They love routine. Yeah, and that's what I would do.
How do you handle animals that are nervous, anxious, high drive? Like, how do you
I call
Several
it,
there.
yeah. How do you handle animals that are nervous, anxious, high drive? Well, I try to get a relationship with them, you know, and figure out why are they anxious right now? Why is it that we're fired up to do whatever you're going to do prior to coming into rehab? And the other resource I would use is a behavioralist. I know several of them that are very, very good at dealing with problems that are a little more advanced.
You guys have any
You have any other questions? I'm sorry.
How do animals who have undergone amputations do?
Oh, good call. So the question is, how do animals that have undergone amputation do in rehab? They do great. I think you guys know dogs have an extra leg. You know, they can work great with 3 legs. Is it better to take a back leg? Yeah, because they steer with the front too. But I have dogs that come in. In fact, all the stains above my pool are from Lewis, who was a 3-legged dog who would constantly just splash in the pool. We'd throw the dummy and he'd jump off and swim. So there's a picture of him out in his wheelchair. And when the students come by, I always ask, do you guys know what that problem is with that animal? And they look and they're like, I don't know it, because you can't tell by his lateral view that he's missing a leg. So I said, well, he's missing a leg. And so yeah, they do great, is the short answer.
Do you have any recommendations for exercise protocols for active kind of agility dogs, things like that?
Agility, yeah.
Around that.
Yeah.
topic?
So do I have any recommendations for exercises for agility dogs or field trial dogs or any of those guys? You know, they love to do what you want them to do. So if it is field trials or agility, they love to do something with you. So maybe not one of those things to exercise them. Maybe something else, throwing the ball, taking them to the lake, swimming, something different than the thing that you love to do together, whether it's agility or nose work or whatever. Those things are great. And they have drives, you know, they have a sympathetic system that causes this drive. So those things are great, but just like anything, too much of a great thing is not great. So mix it up is the answer.
Talk through kind of around the topic of massage therapy, tissue release.
Yes, the question is topic massage therapy and tissue release and things. So anytime you can massage and warm the tissues, and that's basically what we're doing at this level, because we have a certain amount of time we can work with the animals. So anytime you can create friction in those tissues, you're creating heat, which of course is creating vasodilation. If you can feel knots in the muscles, as we know, we love to work those out. So it kind of goes back to what we do in here as opposed to what you can do at home. So all those things are great, except we don't really focus on them in here. We can show you how to do them, but like I said, we focus on the underwater treadmill and the laser and things like that that you don't have at home, things that financially are kind of out of the ballpark to have at home. So those are the things that we do. We'll definitely send home exercises. We answer questions, but really what we try to do is focus on that half hour of underwater treadmill, laser, ultrasound, however we're doing that.
Any recommendations for dogs with really long backs?
Dogs with really long backs. Oh, that's like that question. Hey, Dave, what's the best breed? It's like, I see a lot of dogs with long backs that are usually broke. So they're inherently prone to IVDD. It's just the nature of the beast, no pun intended. When they jump off something, they'll bend their back, and guess where they usually bend? Right at T12, T13. And again, if this is something that they develop, it's not something that goes away or we can cure. They have it for the rest of their lives. So jumping up and off things is a bad idea. Getting stairs for them to get up on the couch, up on your bed, that's a great idea. Helping them into the car is a great idea. It shouldn't limit their exercise though, just because they have this anatomical craziness going on. They still love to go for walks. They still love to play. And I would never take that away from them. So controlled fun.
Recommendations for how to help animals who are old dog vestibular disease or had a stroke. Kind of those sort of things.
You know, with those guys, especially nursing care, they feel really bad if they lose their bladder inside and things like that. So really, at that point, it's just paying attention to their needs. Depending on how severe the vestibular disease is and the head tilt and things like that, if it's responds to antibiotics and things like that. So it's not an end of the world situation. It's just, again, I think nursing care, spend some time, take care of them, pay attention, and they do pretty well. Last question.
For veterinary professionals that want to learn more about rehab or just kind of further on education, what are some resources we can provide?
Oh, well, my favorite,
Can you repeat that?
oh, yes, sorry. So the question is for veterinarians or soon to be veterinarians or up and coming veterinarians, what are some of the resources for rehab? YouTube's huge. You know, you can look up exercises on YouTube. That's a great resource. I personally like the book by Millicent Levine. We have it here at OSU, and it speaks both in medical terminology and in lay terms. So I really like that book. It also has a end chapter with protocols for rehab and particular to particular procedures, be it hemilaminectomy, TPLO, things like that. And it gives you 2 weeks pre all the way to 16 weeks post. And if you guys look at that book, you'll notice there's a lot of things you can do, and there's not much that's contraindicated in those cases. There's so many things that you can do that it's basically hands-free, you know.
What's the name of that book?
It's Canine Rehabilitation by Daryl Millis and Dr. Levine. I forget what his first name is. It's an excellent book. Get the second edition. That's got the protocols in the back.
And kind of a wrap-up question, can you walk us through what a treatment regimen looks like?
Oh.
You bring an animal in and just sort of.
Sure. So the question is, if you were to bring an animal to see me, what would the procedure look like? Well, first of all, you'd go end up seeing one of our surgeons. They would do an orthopedic and a neurologic exam, go over that. We'll talk about what your plan was as far as the future. Then you would meet with the rehab service. We would talk about goals. Ideally, depending on what process is going on in your animal, 2 times a week is the gold standard, but we don't want to, you know, put anybody out of the house or anything like that. So we'll work with whatever your schedule allows. Some people live quite a distance, and so we'll work with that. We give exercises. We'll look up other rehab centers in the state or outside of the state and help the client. Once we get that started, each animal is different. So quite often we'll look at a 12 to 16 week program, but each animal is different. And depending on what the disease process is, for instance, femur head osteotomy is going to recover a whole lot quicker than a hemilaminectomy. So dachshund is not going to recover at the speed of a Labrador that got a FHO. And so we have to look at things that way. Yeah, let's do it. That's it. Have a wonderful evening. Have a good week. Thanks so much.